Welcome, Tigers and guests. My name is Joanna Cheshire, president of the Suncoast Tiger Bay Club, and your host for today's virtual event. Since 1978, the Suncoast Tiger Bay Club has served as a civic commons where thought leaders and citizens of all political stripes come together and discuss the pressing issues in our community. It has never been more important to engage in nonpartisan conversations, ask the tough questions, and foster a better understanding of public issues. Since we cannot be together at our monthly luncheons, Suncoast Tiger Bay Club is committed to bringing those conversations to you with these virtual events. I want to thank you all, the Tigers that have responded to the survey we recently put out. The board is entertaining the idea of finally coming back together in person again. So we will send more information out on that very shortly. Please help support our continuing commitment to delivering timely and informative programming by becoming a member of Tiger Bay, renewing your membership, or just donating today. A donation of $25 or $35, which is what you would have spent on a good old-fashioned Tiger Bay luncheon, will help sustain our club and allow us to continue to keep you informed and connected to our community. Also consider promoting your business or organization by sponsoring a Tiger Bay event. Event sponsorships support our Young Tiger Scholarship Program, so you can contact us for more information on that. Suncoast Tiger Bay Club is committed to the development of our future leaders. We call them Young Tigers. Each meeting, we welcome local high school and college students into our discussion. I'm very happy to introduce the Young Tigers for today. We've got folks joining us from Dunedin High School, seniors Isabel Schuler and Brian Havens, and juniors Mariana Fonseca and Aiden Whittakin. They're all watching with their chaperone and school principal, James Kiblinger. Welcome, and thank you so much for joining us today. I definitely want to let you know that if you do ask a question, which we hope you do, indicate that you are a young tiger in your question. So Tiger Bay has always been committed to digging into tough conversations that affect our community. Today, we're talking about food insecurity, food equity, in the face of hunger in our community. We are excited to have many changemakers on our panel and even moderating today. It's not lost on me that we are discussing food insecurity as we probably are eating our lunch from home or in our office during our lunch break. So please just keep that in mind. And don't forget to submit your questions through the Q&A button at the bottom of your Zoom screen. You can submit questions at any time during the program, and we will get to those. So now I would like to introduce today's panel. Wendy Wesley is a food policy activist, nutrition equity, registered and licensed dietitian and nutritionist. We've got Mandy Cloninger, Chief Impact Officer from Feeding Tampa Bay, and Julie Rocco, Senior Community Engagement Advocate, Research and Evaluation for Foundation for a Healthy St. Pete. Our moderator today is Hillary Van Dyke, Professional Development Specialist, Equity with Pinellas County Schools. Thank you so much, Hillary, for moderating today. And at this time, I will pass it over to you.
Thank you, Joanna. All right, so let's go ahead and just get right into it. My first question is the easy question. So what I'd like you all to do is tell us who you are and what your project related to food insecurity is, and then most importantly, how people can get involved with your work. And Wendy, why don't you go ahead and get started?
Hi, Wendy Wesley. I'm a registered dietitian nutritionist, and I came to work in nutrition insecurity by working on the stroke and the cardiac floors of St. Anthony's Hospital as the dietitian assigned there. Patient after patient after patient came to me and said, I know how to eat for my diabetes and my cardiac disease. Doctor tells me, nurse tells me, you tell me, the food does not exist in my community. So I surveyed many small grocery stores, dollar stores, gas stations in South St. Pete, and found that the food required to manage these 3 diet-related chronic diseases, cardiac disease, diabetes, and kidney failure, does not exist. And so I formed a group called Nutrition Equity St. Pete. Anyone can join. We have over 400 members, and people are interested in learning more and seeing what they can do to make a difference with nutrition equity. And I call it nutrition equity instead of food equity or food insecurity, because we can load a community with calories and food. Our goal is to load the community with nutrition. And I've got a couple of cool ideas brewing to make that happen. Thank you.
Thank you. So nutrition equity to fight against food apartheid. I like it. All right. Mandy, what about you?
Thank you, Hillary. Thanks for the opportunity to share. My name is Mandy Cloninger. I serve as Chief Impact Officer for Feeding Tampa Bay, and we are the leader in hunger relief across this 10-county area here in West Central Florida. We rescue food from everywhere in the food supply pipeline before it might otherwise end up as waste in the community. And last year, we distributed about 65 million meals across our 10-county area to improve the health and the capability of the neighbors we serve. So I love what you said there, Wendy. It is about getting nutritious, healthy food to our neighbors. And we partner with about 500 different agencies across our 10-county area. It's everyone who's touching food in our community that you might imagine. But we also know the historic level of need that has presented itself in this last year has required a heroic response from hunger relief. We're part of the Feeding America network of 200 food banks, and the lines that you have seen on the news are very real. I served this weekend at one of our mega pantries. Prior to the pandemic, we had never served 1,000 or more neighbors at a time. This is a real urgent and pressing issue in our community, and we need more than food to solve it.
All right. And finally, Julie.
Hillary, thank you. And thank you, Tiger Bay, for the opportunity to speak. I'm with the Foundation for a Healthy St. Petersburg, and we focus on race equity with the health equity framework. And specifically as it relates to food security in our community, in our neighborhoods, we have a multi-pronged approach of planning, programming, and policy. From a planning perspective, what that means is some of the research that we've commissioned to try to gain a better understanding of what are the challenges and opportunities in our community-based food system that we might be able to help elevate and activate our community around. As it relates to some of the programming, one of our, what we would consider a flagship program in the community that we're helping to support is the Youth Farm at Enoch Davis. That's a community-led, youth-oriented program, as well as some of the food distribution sites. We've worked with Feeding Tampa Bay. We've worked with Wendy. Happy to be with my colleagues today on this, who I consider experts in this field and that I've leaned on as thought partners in this work. And then more recently, partnered with the City Council, specifically Councilmember Gina Driscoll had approached the foundation in our work. After finding out, we did a scan of focus groups. We called them Food for Thought within our community. And when asked what's the boldest idea that our community may implement, unanimously, a food policy council is what was brought up over and over as an opportunity for us to collectively and holistically create a comprehensive approach to addressing our food system needs. And so in working with City Council, St. Pete City Council, there was a resolution passed recently to implement a St. Pete Food Policy Council as an advisory arm of the City Council and make recommendations as it relates to food policy. As far as getting involved, there are a multitude of opportunities. I encourage volunteering at these wonderful organizations that I'm certain you'll hear about today, as well as from a policy perspective. If you have great ideas, innovative, inspirational, aspirational, please send them my way or to your City Council members as well. There are multiple conduits of opportunity to engage in that way. So thank you.
All right. Thank you so much for those introductions. Those are wonderful. I have lots of notes. All right. So my first question, or second question, I guess, is can you, and anyone can answer, so 1, 2, all 3 of you, up to you, but can you tell those of us that are listening today, in what ways are you authentically engaging vulnerable communities and communities of color in your work? When we think about food insecurity, it's not necessarily like a Black problem or a brown problem, but we do know that oftentimes these issues, because of issues of systemic racism, might end up impacting those communities more. So can you tell us a little bit about how you authentically engage those communities?
We know that hunger and food insecurity disproportionately impacts communities of color. In fact, it's twice the regular rate. So our Black and brown neighbors experience twice as much hunger and food insecurity as our white ones do. And then it's 3 times that amount for our Native American and Indigenous communities here in Florida. And Feeding Tampa Bay has long been partnered with those in the community already serving. And so when we think about areas of poverty, you can look across and there may be a local church food pantry, there may be a synagogue, there may be a mosque. We are rescuing food and providing it directly to that agency, who is the official boots on the ground, the grassroots organization who's already serving in those communities. And when we saw the pressing needs during COVID and how even more so, we made intentional solutions that took food directly into certain zip codes and areas that we knew were disproportionately impacted. And so we reached out to our partners with United Way, as well as city and county governments, to get food to more folks in need. You'll see our mega distributions. I was in West Tampa this weekend. We do distribution at the Trop. And really, we've tried to identify spots that can allow folks to access that food, whether it's on foot or by public transportation, because we know folks are willing to travel about 4 to 5 miles to get to food, but really they shouldn't have to. And so we've also innovated with some home delivered solutions during the pandemic that we never did prior to that as well. And that's really truly in partnership as we started hearing from folks who were homebound. And then we identified locations like senior communities and lower income housing communities that really needed that access to food. And when we do that, we respond with that food today, groceries and home deliver meals, but we also connect them with food for tomorrow. And for many of those neighbors, it was accessing SNAP benefits they didn't know they qualified for.
One of my former patients at St. Anthony's Hospital, he lived very close within walking distance to the Walmart at Tangerine Plaza. He was managing his 3 diseases, cardiac disease, diabetes, and kidney failure very well when the store was opened. That's when I was seeing him in the hospital. And then he came back after the store was closed, and his health tanked. He began eating out of gas stations and grocery stores. And so I began to speak and write about the closing of the Walmart at Tangerine Plaza. And I had the opportunity to speak this weekend with Alan Delisle of the city's development department. And he feels very, very confident within the next couple of months that a lease can be executed with the choice of the mayor, which is the Sugar Hill Development Group, to bring a 10,000 square foot grocery store to Tangerine Plaza using a local grocer who's already in the community, Taste of the Island. So, and then that will go in front of council, a term sheet will go in front of council. And at that point, I would bring together the people I've cultivated through Nutrition Equity St. Pete to come and speak in favor of it, or to offer suggestions or changes or input on that. So really trying to get more nutrient dense foods into all parts of St. Petersburg. So all of St. Petersburg nutrition landscape is more level than it is right now.
Julie, before you talked a little about the focus groups that ended up leading to the Food Policy Council, has the Food Policy Council started to meet, and what does that group look like?
Sure, we have. And I just wanted to briefly circle back. I noticed you said authentically engage communities of color. And I think it starts with listening. Listen and create community-led opportunities that we can follow, essentially. Some of that looks like these focus groups that we did implement and lead that led to the implementation of a Food Policy Council. We're helping to facilitate a solution the community aspired to achieve. So the Food Policy Council, St. Pete Food Policy Council, has begun to meet, and it's seated with 25 voting members comprised of representation from the food system, as well as lived experience in neighborhoods, Where there were inequities, when you look at the data is really clear. Where there are specific disparities and inequities, we look at inequities from a structural and systemic barriers to food access, nutritional. Concur that food swamps are not the solution. There's dense fast food in certain neighborhoods where there is not dense of nutrition. So the Food Policy Council recently drafted a recommendation to support ordinances that Councilmember Brandy Gabbard put forward that helps activate the full breadth of the community in agriculture opportunity and sales opportunities. We're continuing to meet to look at. One of the questions we initially asked was, what does it mean to be a successful Food Policy Council? What will be our accountability? What will be a scorecard of impact that we're going to create? So we're starting to look at that. We're scanning across the country to see what templates and other models have proven. And actually, some of the research shows that that's one of the deficits in some Food Policy Council work is how do you know if you are effective? And they're starting to work towards that. And then we're also looking at building the infrastructure. So we are building infrastructure, building evaluation tools, while also looking at the opportunities to review potential policy implications. And then we'll be proactive in identifying, once we scan our food system more fully, to initiate conversations around policy.
Thank you. All right. So that was a big question, and I'm going to add to that question with an even heavier question. All right. So thinking about authentically engaging communities of color, vulnerable communities, what are some... I heard all of you already talk about ways that you've identified what communities need the services. So I was glad to hear that. But for you, how are you defining success, and how do you know that you're making an impact? So how do you know that you're doing what it is you're setting out to do? No pressure.
Well, if I had a dime for every time someone said to me, I had no idea, meaning that there's a Publix across the street from another Publix down the street from a Trader Joe's, a Fresh Market, a soon-to-be open Whole Foods, and a Rollin' Oats and a Winn-Dixie concentrated in a 1 mile area of Northeast St. Pete, compared to what you'll find in other large areas of South St. Pete, and then moving up to Lellman, Pinellas Park, and then Northeast St. Pete up 4th Street in the 70s, there are USDA designated food deserts all over St. Petersburg and Pinellas County. And so I judge how well I'm getting the word out by how many times someone says, I had no idea. And so I've just been spending the last 2 or 3 years just kind of getting the word out that there's work to be done. And then right now I'm talking with a nonprofit called 360 Eats, and modeling something after very, very successful program done in Washington, D.C. was the Corner Store Market program. This nonprofit sold at wholesale prices produce to these small grocery stores, and of which we have many in St. Pete. And so this is doing is taking advantage of what is already there instead of trying to build new from the ground up. So yes, we do need a grocery option at Tangerine Plaza, but we also need to figure out how to get more nutrient-dense foods into what is already existing. And this also creates amazing economic opportunities for these small grocers. So the example set in DC, so after 1 year, sales of produce in the second year alone of the pilot program increased 38% at these small corner grocery stores. And that netted the stores over $228,000 in produce alone, just in produce. That's not snacks and drinks and all the other things that small grocery stores and corner stores sell. So working with 360 to implement this really amazing success story that was implemented out in DC, because there's no reason for us to reinvent the wheel in St. Petersburg. There are so many amazing examples nationwide of food policy councils and what other nonprofits and concerned citizens have done to make a difference with nutrition insecurity and then health outcomes. And that's where I come from the chronic disease and clinical background, is the biggest killer of Americans is cardiac disease. Cardiac disease can be managed with medication and diet. Same with diabetes and to some extent kidney failure.
I like that marker of the I had no idea. And the other thing I would say too is I always like to use the phrase food apartheid instead of food desert, because deserts are naturally occurring, whereas apartheid is, created through systems and systemic inequity. So that's my little dollop for the day. Who else? What are your markers of success for
I'll
your work?
piggyback on Wendy. We have studied and looked at other food banks across the nation who have successfully ended hunger in their community. And that doesn't necessarily mean that no one's hungry, but there's no barriers for them to access that food and that there's enough food available in their community. And we study the demographic data, folks who are living in poverty, folks who are part of that ALICE population, asset limited but income constrained. And particularly because of the pandemic, that group has been hardest hit. 2-income households going down to 1. We may not be able to end food insecurity, but we can end hunger. And for us in this community, that means we're rescuing and able to distribute close to 130 million meals across our 10-county area. The year prior to the pandemic, we hit 65 million meals. This year, we're looking to hit 90 to 100 million. And that's because we, had the notch turned, the heat was turned up in a lot of ways because of the pandemic, which led to really systems-based responses across a lot of different places, counties, cities, governments, folks working together more than they ever had to make sure that folks in need could access food. And so for us, what it looks like is no matter where you are, that there would be a local provider able to offer you food for today, connect you with the benefits and resources that's going to free your family's income up, right, to keep you stable. And then there are opportunities that really do address the systemic racism and lack of capability for our neighbors. And that's why we offer food for a lifetime through some workforce development programs that really address the capability that's needed for folks to gain an income that they can become stable. And so that's what it looks like for us in the community, is that there's no barriers to accessing food and everyone has an opportunity to improve their health and capability. And overall, we have a much healthier community.
And Mandy, I think you've brought this up, but I'm going to pivot to this question. Can you all tell us how have you adapted your work during COVID-19? And then in this future post-pandemic that we keep saying that might exist one day, what are some new ways of work that you've adopted that you are thinking about keeping as you move forward?
Yeah. For Feeding Tampa Bay, we really doubled our meals out the door. At the peak of COVID, we were serving as many as 2 million meals a week. We know at the peak of COVID, the number of neighbors in need nearly tripled across our region. And so we also purchased more food than we ever have in our history through partnerships with city, county government, and philanthropy. But we can't throw more food at this problem. We really can't. We've really got to address the systems change. And I think that's where the Feeding America Network and lots of folks in the nonprofit space, our public-private partnerships and our healthcare partnerships are really thinking differently about this a lot now. So we are looking into real systems change and talking about as a network that addressing hunger and food insecurity, we have to address the root causes, which is systemic racism and poverty. And I think that's a dialogue shift I haven't seen in the past that's elevated to a certain level that I'm hopeful for real systems change. I really am. And we've seen some address of that really through the benefits that came out through the ARP, a move to increase the SNAP benefit by 15% when we're seeing historic levels of grocery store prices, right? So a 15% increase when you know what's happened at your household budget with groceries, that needs to be extended permanently for our neighbors who are relying on SNAP. And so I think it's all of us that are in this room that care about this issue, really elevating it to make sure we're addressing the root causes. And it becomes a part of the solution all the time. Lived experience, the voices of our neighbors and guests are co-creating the solutions with us all the time. And they're telling us the barriers that they have accessing to, they're telling us about the challenges they have in getting their application for SNAP filled out because they have to wait 4 hours on the phone. So we have to address the system there, right?
Go ahead, Wendy.
As an activist, I can tell you what worked during the pandemic was having city council online by Zoom. This radically increased the amount of engagement I see. And now that people can't engage with city council, speak to city council during open forum or other development review commission through Zoom, you have to go down to City Hall during working hours and sometimes wait. I was with Andy Oliver waiting 6.5 hours to advocate to the Development Review Commission for his garden. Who has that kind of time unless you're self-employed the way I am? So I hope that our city council can return to a Zoom format so that we can increase the amount of civic engagement, because I'm pulling together lots of people to come talk about very important issues. These people work, cannot take time off to come sit in council chambers and wait for their turn at the podium. So let's return to an online format with city council and DRC.
And then Julie.
Yeah. Hey, Hillary, thanks. I would say our initial response when COVID became apparent what level of influence it would have in our community was, how can we quickly develop a rapid response and deploy resources immediately through our different partnerships. And we were fortunate that our community did come together and collaborate on countywide calls. And so creating those ongoing channels of communication where often work is siloed. I hope that will continue as a larger food system to collaborate in a holistic approach. And then additionally, COVID, I think, let us know how vulnerable our systems are. And so what are the resiliency plans that we can move forward so that they're sustained throughout this initiative and that we are able to look at the infrastructures that can support this. So, for example, the ordinances that were just passed, or Andy Oliver's, and yeah, Wendy, that was awesome to have that support of the community. That's a resiliency tactic to say I can grow my own food. I don't have to rely upon the food system distribution sites that can't get to us and things of that nature. So how are we going to use policy even to continue to look at building in the resiliency and democratizing essentially our food system, where we're amplifying multiple voices that help shape the ongoing future of our food system here and food security in our community.
And did any of you see the impact of, or did you feel specifically the impact of students being at home and doing school at home, having an increase in the types of people that you're serving?
Yes, we partnered with Tampa Bay Network and Hunger. We partnered with Feeding in Tampa Bay. We partnered with the St. Pete Free Clinic specifically. Again, looking at the barriers to access. If transportation is a barrier, the Meals on Wheels for Kids program that was implemented, where you also stack some functions of need, where bus drivers that were put on maybe leave, how can you redeploy them to meet a functional need that came about due to COVID? So meals, bus drivers, kids that need food, so, and continuing to our Center for Health Equity was activated to be a site where individual families came for food distribution. The Arts Exchange, again, how do you reconfigure resources in your community in a unique lens? You do that when you have to be innovative through crisis, often creates new opportunities. So the Arts Exchange stepped up, and we worked with Feeding Tampa Bay to create a food distribution site in South St. Pete that normally wouldn't be recognized in the community in that way. So continuing to activate resources that we already have. How do you look at assets with a different framework and lens? And crisis allows you to do that.
Yeah, I know with the school district, especially when the schools were closed during the fourth quarter, we were doing food pickup because for a lot of students, they're getting fed at school. I do want to clarify that some of those, it wasn't just South St. Pete that we were doing that. It was all through the county because we have vulnerable populations everywhere. But that we were like sort of our little mini Feeding Tampa Bay for like a minute. But like now, Mandy, I saw you like head nodding. Are you seeing like a lot of, how are you seeing that the student population impacting who you're serving?
Yeah. So even prior to the pandemic, we often talked about 1 in 4 children are hungry in our community. And when a lot of children lost their free and reduced breakfast and lunch, it was a huge issue. We had already been partnering with many of the school districts to provide food pantries in some of the hardest hit neighborhoods. And so the school's closed, a food pantry is closed. We had to innovate and do all sorts of solutions, whether that was the home delivered meal program. We ramped up and made frozen meals that we distributed a lot of schools and did pickup sites alongside groceries. And then pandemic EBT really did help and continues to help a lot of families with children. And so I probably sound like a bit of a broken record about SNAP and pandemic EBT, but that really put the dollars into folks' pockets that was needed to purchase food. And that's the best way to purchase food is with dignity, where you choose your own food. And they're no longer having, they can rely on the network of food pantries and food banks as they need to, but that they have enough income to keep their family stable and access those groceries is critical. We're now that schools are, many of them are reopened. We're seeing renewed interest in the food pantries and equipping them with nutritious and healthy food. We're always looking for ways of adding the right locations to reach more children with dignity. And so I would say that's part of our long-term solutions that are going to stay with us for indefinitely. We know that the folks who have been hardest hit, it's going to be an 18 to 24 month recovery for them and maybe longer. When we saw this arc after the last recession and hunger and food insecurity had leveled off, but now it's spiked back up, and that's going to take a while to come back down. So we're going to continue to evolve our solutions to make sure kids can access food.
Right. All right. So before I pass things over to Amy to check out what's happening in the Q&A, I did want to just make sure that I shout out a couple other interesting things around food insecurity. Things like the St. Pete Youth Farm, the Edible Peace Patch are doing work with students to make sure that they're teaching young folks how to grow their own food. So when we think about that, like future sustainability, and these 3 things that I'm shouting out to you as a human who grows food in her backyard. So that's just my like green thumb nerd self shining through. But then another one for those of you who do have interest in growing your own food but are at a loss of what to do, Peas and Love Gardens is a Black-owned business that helps Tampa Bay residents plan, build, and refresh edible gardens in their homes. So definitely check those out. And later, Amy will do something with that information. I think put it on the Tiger Bay Facebook or website, Facebook. She'll do something with it. But those are 3 another side of that conversation too of thinking about growing food. So Amy, are there any questions in the chat?
Yeah, we do. We have some great questions coming up. And yes, we'll put any contact information for those programs and the programs that our panelists have brought up today in our Facebook feed so that everybody can access that. And then one of the questions that came from our audience was, will the recording for this session be available? The answer is always yes. We try to get the recordings of our events posted on our website as soon as possible after the event. So we'll hopefully have this one by Wednesday on the website for those who did not catch the whole thing or want to make sure they have friends and family who want to watch it. The first question I'm going to ask here, it comes to us from Tiger member James Gillespie. What would the average family in our metro area have to spend weekly for good food? That's kind of a tough question, and I'm not sure if any of us have the stats to answer that in a direct way. Does anybody have a thought on that?
A lot of that answer is dependent upon transportation. USDA designates, and they call them food deserts. That's how the USDA calls them, as low income, low access, and also they factor in access to transportation. So you have to kind of, how do you in the middle of August get 10 to 20 pounds of good food, which tends to be heavier than processed food, from the store to your home or using public transportation? So it's kind of it's a bigger question than just money in the bank. It has to do with time, it has to do with transportation, and it has to do with access. There was a Winn-Dixie open on 4th Street up in the 70s, kind of 75th, 76th, and a lot of people on fixed incomes who live in mobile home parks shop there. Now that it's closed, they have to cross 4th Street and make their way to MLK to the Publix to buy their groceries. So this, when you think about a lot of people on fixed incomes in mobile home parks who don't have automobiles, going to the Winn-Dixie with a cart used to be easy. Now it's a bit more difficult with a pull-behind cart in August when you're in your 80s. So it's transportation is a major factor when it comes to food access.
And I just real time Googled how much does an average family spend on groceries? And in the Tampa Bay area, one of the studies I found, it says it's about, well, there's a grocery spend and a total food spend. So they're also calculating time dining out. So it was about $350 in groceries, $600 a month in the average total food spend. And, to Wendy's point, that's actual dollars spent on the food. That's not calculating all the other ancillary expenses that go into purchasing food, the electricity to make the food. So there's a lot around food preparation as well.
Thank you, Julie. And thank you, Wendy, for those answers. The next question comes from Tiger member Beatrice Farrell. Confirming that nutrition inequity exists all across St. Pete and not just on the southern side of St. Petersburg. This issue affects all communities. Unfortunately, though, it's concentrated in South St. Pete, correct?
I would say hunger is in your backyard. 1 in 4 children are hungry. We used to say 1 in 7 neighbors are hungry, but it's 1 in 6. So I would imagine there's even someone on this call who experiences food insecurity and doesn't know, maybe is stretching their budget. So it's a inner city, it's a rural, it's a urban problem, it's suburban, it's literally all across our community. We used to use the analogy, picture 10 Raymond James stadiums filled with hungry people all across Tampa Bay, because that's how many. You throw in a pandemic and it nearly tripled that number. We all know someone who lost their job or has been impacted by COVID. We all know someone who's struggled with hunger.
Thank you, Mandy. Anybody else want to weigh in on that one, Wendy?
In South St. Pete, there are 3 Dollar General, just Dollar General. That's outside of Family Dollars, which are a different company. But the Dollar General has launched nationwide something called DG Fresh, and it features fresh produce, meats, and dairy. And so I've done some research, and some cities have convinced their Dollar Generals to convert to the DG Fresh model. So again, this is plugging into what's there and not trying to build new. So the Dollar Generals exist. Can economic development work with this major corporation? And they are the fastest growing retailer in the United States. Dollar stores are the fastest, faster than Starbucks, faster than anything else. They are growing at an alarming rate. And so when I learned that Dollar General was implementing a new model called DG Fresh, I was over the moon. And so I thought, well, why not here? We have 3 Dollar Generals in South St. Pete. We have 2 in Lellman and 1 in Northeast St. Pete. So boom, boom, boom. They convert to DG Freshes, and we have nutrient-dense foods at an affordable price in our communities. And I also, as a dietitian, say something that is a bit, sometimes gets me a little trouble. I say that organic is a dirty word. I believe that organic creates the haves and the have-nots in the food system. I can't tell you the number of times a patient said, I can't eat fruits and vegetables because I can't afford organic. And so then I give them permission to shop at Save-A-Lot, non-organic, fresh and frozen and canned, and get produce into our bodies. But again, I think that organic is a dirty word. It creates an unlevel playing field and the haves and the have-nots. And so I'm your dietitian. I give you permission to not eat organic.
Thank you, Wendy. I think we'll move on to the next question. This is a question from our Young Tiger team at Dunedin High School. When will the state or nation be pulling back on the free breakfast and lunch for all students so we can be ready to check on families that still need food, help, or support?
I'll speak to this. A lot of the changes in child nutrition and even in pandemic EBT and SNAP are through September. And so I would say it's in our best interest to advocate for long-term changes. So I would say don't wait till it expires. Sign on and be a part of the advocacy that, extends some of the flexibility in the child nutrition programs. Strengthen the food network to respond, and then keep the pressure on to extend the SNAP increase in pandemic EBT as long as it's needed for folks to weather this crisis.
Thank you, Wendy. Anybody else want to jump in on that one, Julie?
Yeah, I would also, to echo Mandy as far as when to get involved yesterday, as it relates to advocacy and elevating the dialogue around what are the rights to food access in your community and in schools, working with your school district as well to get a better understanding of what are the access points of food carts and the dignity of just a snack, grab and go snack. And what does that mean for a student to have those opportunities at the backpack programs? All Children's Hospital has worked with some of the schools to create the backpacks that go home with families, and what does that look like? So I would continue to galvanize your passion around this topic and work with your schools. Work local, think global kind of thing, maybe where you can get some early successes as well in your programming. Thanks for asking the question and being students engaged in the work.
Yes, thank you so much for our Young Tigers for submitting that. Our next question comes from our guest, Gregory Haney. Hi, is there any effort in the Tampa Bay area similar to the 412 food rescue in Pittsburgh to redirect surplus food from food retailers and restaurants to food insecure persons, which of course also reduces food waste? If not, any thoughts on the feasibility of mirroring such a program here?
We have it here in our county. It's called 360 Eats. And I'm really, really excited about what they're doing. What they do is they take food that is destined for the dumpster from Aldi, perfectly good food. For one reason or another, Aldi cannot sell it. For instance, if one egg is broken in a dozen egg carton, the whole thing goes in the trash can. If the sell by date is 1 minute over, trash can. If the best by date is 1 minute over, trash can. So 360 Eats rescues this food from Aldi, and they take it to their kitchen and they cook it up and they serve it to communities in need. They are primarily located in North County. Safety Harbor is where their commercial kitchen space is, but they are definitely making inroads down in St. Pete, and I couldn't be happier. And so, interestingly, the DC Corner Market program pilot that I talked about earlier was started by a group that was rescuing food. And then this nonprofit branched out and they grew. And that's when they began buying produce wholesale and selling it to these corner store markets. And what it did, it proved in the city of DC, where people said it couldn't be done, that there is a massive market for fresh produce. Where there are people, there is an interest in fresh food, regardless of race, income. That's what the DC model proved, is if you put it in the stores, people will buy it.
If I can answer as well, when we think about food recovery, there's so many points of nexus around food justice, environmental justice, and social justice, where if we're able to divert food from our waste stream, there are multiplying positive impacts that it creates in our community. And when we look at food that's going to go to the waste stream and diverting it, we look at the food hierarchy. Is it edible? If so, get it in somebody's belly. If it's only edible to animals, if we have a farm that needs it, take it to feed local animals. If it's at a stage where it will only be great for a composting opportunity, there are touch points of the food distribution sites that maybe get the food too late. That's another challenge, is the grocery stores are getting it to the food distribution sites sometimes too late. If that happens, though, rather than, again, taking a dumpster to sanitation, take it to a community garden to compost it. So at least we're keeping the nutrients in our soil. There's also a Waste No Food app where pre-COVID, they may resurrect it post-COVID. If a restaurant had leftover food that could be redeployed into one of the homeless shelters, they go on the app, they say that they have the ability to package the food, and then somebody claims the food and comes and gets it. So it's creating these different systems that prevent the leakage, so to speak, in our food system and closing those loops. So thanks for that question. I'm not familiar with 412 Food Rescue. I will look into it. And if any of you have resources that you want to drop into the chat that you'd like for us to explore in our community, please do so.
And Mandy, I think you had something too.
Yeah, I was going to say, great question, Greg, and we appreciate your commitment and support for addressing hunger in the community. We have a great example of this that happened during the pandemic, in particular, because so many restaurants and hotels had closed down. We shared our model of preparing low-cost meals, and even in Pinellas County, the Carroll Hotel and the Food Truck Association helped us ramp up to the peak of COVID, where we were preparing 40,000 prepared meals and delivering them throughout the community. And so we were able to employ restaurant and hotel workers who had been furloughed or otherwise wouldn't be working to help us scale to meet the need at that time. And that is staying with us. So where our kitchen hits its capacity and we partner with local restaurants. And then we used a few innovative partnerships with Uber Eats and Amazon delivery drivers who helped get that food out. So, and then you're actually describing the food banking model on a global scale. It's trying to ensure that none of the food that is edible in our community goes to waste on any level. And so we work with farmers, we work with restaurants, we work with hotels, we work with manufacturers, anybody in the food supply pipeline to rescue food. And so anything that can be done to strengthen that network, we are always wanting to listen and hear of opportunities so that we can ensure nothing goes to waste.
Oh, thank you so much, everyone, for the answer to that question. This next question comes from Corey Givens Jr. Would you support funding a community-owned food co-op over a national retailer to fill the vacant spaces in Tangerine Plaza and Pinellas Point?
I would, most definitely. And there is a local grocery co-op, the One Community Grocery Co-op is gathering members right now. The grocery store option in the RFP the mayor chose is Taste of the Islands. They have a store on 34th Street South in the same plaza as the Foundation for a Healthy St. Pete, and they are the chosen grocery store tenant at 10,000 feet. And then the city would need to negotiate the lease that Walmart holds on the space. But the city feels confident that they can get Walmart to budge and allow this local grocer to come in. I'm pleased that the grocer is local, but I think a co-op model, many co-op models would in throughout the city are needed. The co-op idea is fantastic. Owner owned, owner run, owner managed. That's the way to move the needle, is not from big government coming down and making big, broad stroke decisions, but individuals coming in and owning where they shop, shopping where they own. So thank you.
I just have to say, before you do any other questions, Amy, earlier Julie had said the quote, work local, think global, and just everything that I'm hearing, that it just keeps coming back to that for me. So I love all this. All right, sorry, keep going.
Awesome. Thank you, Hillary. Well, I think, Hillary, unless you have more questions on your list, I think we're going to go ahead and we're going to morph this one remaining question into an opportunity for each of our panelists to sort of give us some closing thoughts. So Rebecca Falconberry wants to know what the best way for regular citizens to get in there and help. But then also, I think we'll start with Julie. We'll go through a round robin. Give us your kind of closing thoughts, and then let us know how we can connect everybody on this webinar with to help out, or whatever they can do to help these programs. Julie, you want to start us?
Sure. Again, thank you so much. This is a topic that has a lot of energy. It's very dynamic in our community, and people are looking for the pathways to express their concerns and opportunities to become involved. Let's say the best, well, I'm not going to say the best way. There are multiple ways to get involved. You find the best way that finds the nexus point between your passion and our community need. There's, again, we mentioned the youth farm at Enoch Davis. They do volunteer days, Tuesdays and Friday nights, or 3:30 to 6:30. They have different classes going on. And then I believe it's the last Saturday of the month. They just had it this past Saturday to honor Women's History Month. The last Saturday and weekend in April, they'll honor Earth Day. There are multiple pathways to get involved with the foundation's work as it relates to race equity. If you hold a race equity lens through what you aspire in our community, please reach out to me. And if you're trying to figure that out, how you can make those touch points between food security. We work towards food security. We're going to promote what we're aiming for. It will address the food insecurities in our community. But shoot me an email. Is that going to be available? I believe probably Julie at healthystpete.foundation. Feel free to shoot me an email.
Yeah, we can post all the contact information you guys want to send me and program information on our Facebook page.
All right, groovy. And then just keep, if you're passionate about something, you'll find our community allows everybody's passions to be fully expressed, I believe. And there was just a garden tour this weekend where people wanted to become involved with their community gardens, how to do that. So I would say stay the course, listen to the experience, and give consideration to, does our community want to represent that food access, healthy, nutritional food access is a right? And if so, what is your role in helping to move that needle forward?
Thank you, Julie. Mandy, I think we'll go to you next for your closing thoughts.
I would invite you, if you're interested in ending hunger in our community, to join a social movement go to feedingtampabay.org. We'll keep you informed as to opportunities to not only share your voice and advocate, but to volunteer locally. And if you know anybody who's struggling with food insecurity, use the Find Food on feedingtampabay.org. You can look by zip code. You can find some of the closest access points to accessing fresh and nutritious food through our network of partners in the community. And I would say continue to use your voice to advocate for food and nutritious food and real policy change to help us end hunger.
Thank you, Mandy. And Wendy, we'll let you kind of take us home on this.
So you can be involved in three different kind of overarching areas. One is environmentally, as Julie mentioned. Environment is food, food is environment. And if you're interested in what local folks are doing environmentally, the Suncoast Sierra Club, the Florida Suncoast Sierra Club, is very, very involved. We have a food action group right now, and we're talking about working with St. Petersburg restaurants to get composting programs going. So restaurants spend a lot of money to throw away a lot of heavy food, and so this is an economic win for our Florida restaurants, our St. Pete restaurants, to compost their waste. Secondly, agriculturally, Sustainable Urban Agriculture Coalition, SUAC, helps you get your garden growing. And they're a network of gardens and farms throughout Pinellas County, and they're a fantastic resource. And then lastly, policy-wise, I started a group. People were saying, I want to get involved. Help me plug into what you're doing. It's called Nutrition Equity St. Pete. We're a Facebook group. And if you'd like to plug into policy and activism around the food space, I can help connect you to that. So that's what I have, and I appreciate you inviting me to this.
Thank you all so much. And Hillary, thank you so much for your awesome questions, and audience, great questions. All right, Joanna, do you want to wrap us up here?
Yeah, I would love to. I'm kind of stunned over here. This is going to take a while for everything to kind of sink in. Hearing from you all, I mean, there's so much opportunity to implement innovative policy. And on the one, isn't it the juxtaposition of the communities that, talking about nutrition insecurity where there's nothing, and then the such wastefulness of other, like our restaurants and things that you were just talking about is just like mind blowing. But anyway, so thank you. Tigers, young Tigers, thank you so much for engaging with us in this other virtual event. We hope to be not virtual very soon. And a special thank you to our panelists and moderator, Wendy Wesley, Julie Rocco, Manny Cloninger, and Hillary Van Dyke. Thank you so much for sharing your time and your talent and all your knowledge with us. I've grown from it myself. And for the advice that I don't necessarily have to eat organic. Thank you so much for that permission. I will definitely take that with you. I've learned some new nomenclature here, and just you guys gave me a new paradigm through which to look at this issue. So thank you. I hope this conversation continues, and all the great resources that you gave us, we will definitely put that out to our Tigers, and we hope to see you panelists as well as Tigers again soon.